Just like many people, I wear many hats, but my most important roles are child of God, mother, wife, daughter, sister, and mentor. Through these roles, I discovered my life's work of being an advocate for mental health. Join me on the new platform, Dr. Tade Talks, as we destigmatize mental health in our community. Hello, everyone. Welcome to another episode of Dr. Tade Talks. I'm Dr. Tade, and today we're going to be talking about how to recognize autism in adults. In my practice, I've encountered so many people with autism, especially people who autism has just been diagnosed in them recently. A lot of them have grown up not even knowing that they had autism, but they had issues in the society with social awkwardness, getting into trouble with people thinking that they are rude. It's really been hard for some of these adults that I've spoken to recently. I myself, I have an adult son with autism, and I do worry about how people perceive him when they encounter him in public, whether people think he's rude when he doesn't respond to them, in the appropriate manner that they think that he should. So that's why I wanted to do this show. I really wanted to, shed some light on what it looks like. How do you recognize an adult with autism? So, we've been talking about children with autism. These children are growing up. They're going into the society. They're in the workplaces. They are, in the marketplaces, they're in our churches, they're in the supermarkets, they're interacting with people. But, a lot of people do not recognize what autism looks like. So today I just wanted to shed some light on what it is that you look for, what you would notice in a person, an adult with autism. So first of all, just like children, they always seem to be in a world of their own. They prefer to be on their own. Like I said, if you encounter them on a bus or a train, they'll be sitting all alone, away from everybody. Because people with autism don't like crowds. They don't like loud noises. They pretty much enjoy their own company. So for example, my son, I would give you a funny thing that he does. When we have visitors in the house, and if he has to give up his bedroom, especially when he was younger. And actually, just recently, over the holidays, he did this. So we had him give up his room to, a mother and her child. And he went into the room in the middle of the night and woke them up and told them to get up, to leave his room. So a person with autism sometimes does not understand some of these social cues. They don't understand the fact that they have to share, their bedroom with someone, or give up their bedroom sometimes when people visit. So you would see behaviors like that others would consider rude. But that's one thing that we have to realize about people, adults and children with autism. They're very, very protective of their personal space. They don't like people in their personal space. So they, like I said, they enjoy their own company. They like to stay by themselves. And we need to understand this and not consider it as being selfish or rude. So that was one. Another point is that adults with autism, they may lack self-awareness of people around them. So like I said, they sit alone in a bus, they're in a party. In fact, you will not even find them in parties. If you find them in parties, they'll be sitting all by themselves, just not talking to anybody. They don't make eye contact, like we all know. So imagine an adult that you encounter. You're trying to engage them in conversation, and they're not making eye contact. They don't look you in the eye. They're not even responding to you, or they keep trying to get away from you. They also may not be aware of the feelings of other people. So if you're crying, they may not, unless they've been taught, they may not really respond to you the way you would want them to show empathy or compassion. And this, you may misinterpret this as being uncaring and, unfeeling, but they don't also pay attention to body language. They don't pay attention to body language. They don't pay attention to verbal cues. They don't understand sarcasm. So if you were being sarcastic, it really is lost on a person with autism. They don't get a lot of the jokes that people make. So sometimes we have inside jokes. A lot of this is lost on them. Let's see. Another point on how to recognize an adult with autism is that they struggle with multitasking. So these adults struggle with multitasking. They have executive functioning challenges. They may not be able to. They may not be able to. How do you say? Kind of organize themselves, plan appropriately. So it's hard for them also to prioritize important tasks. So they have different tasks that they have to do. They may not know that a task is more important than the other. So in the job space, you give them work to do. You give them work to do. It's really hard for them to know this is what I need to do first and this is what is not as important. For example, you have a person in the workplace that you want to do certain tasks. So maybe some tasks are more important, some are not as urgent. A person with autism has a certain way that they're going to structure those tasks. They're going to want to do it in a certain order. If it's a task that they have to do every day, then they're going to, figure out a way where this is what I do first, and they're going to do that task, all those tasks, the same pattern every day. It's going to be the same sequence. So you need to understand that if you're a boss of somebody that has autism, they have a specific way of doing things. They're going to do it the same way every day. When they come in, maybe they go to the bathroom, they wash their hands, they clean their counter, they do the laundry, whatever it is you need them to do. They are always very, very meticulous in how they do things. So it's very important that you understand that if you have tasks that they need to do, with my son, when he started working, the job coach would list the tasks for him, and they train him on how to do all those tasks the way that it's needed to be done. So since the first day he started working, he knows that when I get in, this is the first thing I do. In fact, from just dropping his bag in his cubicle, they had to teach him, then you have to punch in so that at least he gets paid for work. Next thing, he needs to clean, mop the floor, clean the windows. So there's an order, and they wrote it down for him how they wanted it done. So the same way when you have an employee with autism, an adult, you need to either help them to prioritize the task. Very, very important, because they struggle with multitasking. If you come and say, oh, can you go take out the garbage, when taking out the garbage is not part of their job description, it will completely throw them off, and they could have a meltdown right there. So it's very important that you know these things about people with autism. Another thing is they're very hyper-focused on certain topics. So some people with autism, they're very good they can talk to you about sports. They can talk to you about baseball, whether it's soccer. So they know everything. They know the names of every, soccer player. They know how Chelsea and Man U, and, they can sit down and tell you. And that's the only thing they know. Every day, that's all they talk about. So when you see certain people who are hyper-focused on a topic and they're very good at that topic, because people with autism, we call them savants. They're very good at one particular thing. So look out for people like that. You can see that they may have some symptoms of autism. It may be an adult with autism that maybe we never were able to diagnose them. Maybe their parents just never really got them the kind of intervention that they needed, but they're in the society, they're all amongst us. So those are things that we need to be aware of. As we take a brief pause, Kindly subscribe to this channel if you find this video informative. Again, they respond, adults with autism, because we're talking about adults now. We've talked about children in past episodes. So they may respond to noise differently. You will see some of them, they have their hands over their ears. When they get into a public place or when there's a loud noise, they cover their ears because the noise is too much for them. It's very triggering for them. It overwhelms them. You see some adults walking around with headphones, not the little headphones that we stick in our ears, like the really big noise canceling ones. Those people definitely have some sensory issues, which is also a symptom of autism. So that's one way you can recognize an individual with autism. You see a grown man walk into a church or supermarket, has headphones. It's not always that he's listening to music. It may just be that they're trying to cancel out the loud noises. So, and the reason they do this is because they're hypersensitive to certain sounds. So some people, it could be they like music, but then certain types of music will, maybe jazz or the screeching of a keyboard or something will just trigger them. So they have that earphone on a lot of times just to cancel out some of those noises that don't, go with their hearing, basically. Loud voices, for us in our community as Nigerians, we like to shout when we're talking right in front of each other. We're yelling, bawo ni, kí ló ń ṣẹlẹ̀? And then the person with autism is wondering, why are they screaming? Like, I remember when my son was younger, when me and my husband would be talking, or I would be talking with my friends. Even now, because like I said, he's an adult, he's 26 now. When I'm talking to my friends and we're screaming and talking and yelling, he would just start crying. He'd start crying, or he would say, stop, everybody stop fighting. We're not fighting, we're just talking. So loud voices also triggers, adults with autism, not just children, but even adults. So an adult with autism, you could see them, or maybe you'll just see them get up and they'll leave the place. They'll go find a more quiet place. Like I said, loud music, raucous music. Some smells trigger them. Touches. Some adults that you notice, they don't like to hug anybody. They don't want anybody to hug them. They don't want you to touch them. You're wondering, in our culture, we're very touchy-feely people. We like to hug, we handshake, pat on the back. A lot of adults with autism do not like to be touched. They may have communication challenges. Adults with autism, like verbal cues. Sometimes, they may not be able to verbalize what they really want. So when you see someone, you're asking them a question and they're looking at you, they're not responding. It's not that they're rude. It may be that they don't have the words. A lot of adults walking around, yes, they look atypical. They look like, they have everything together. But what you will realize is that they may not be able to communicate with you. They can, if you ask them, what's your name? Simple questions, they may be able to answer. But when it comes to deep conversations, they may not be able to. So you have to understand that when you encounter someone who's not engaging you, it may not be that they may not be rude. It's not that they are shy. They may just not have that verbal repertoire, the language to be able to talk to you and respond to you the way that you want. And I know that, in our community, the way we go, I'm talking to you, you're ignoring me. The person may just not be able to respond. So it's very important that we understand that. They also misinterpret what you're saying sometimes. So if you're talking to them in just the way I'm talking now, they could get confused and misinterpret and do something different. So you say, go bring me, maybe carry that box and take it, bring it with me, or just carry it behind me and let's go. And if you don't explain it, or maybe point to the box and tell them, take the box, lift it up, let's go and follow me. They may not understand what you're saying. So it's important that we when you're talking to them, you talk to them slowly and maybe not in so many words. We do this for children, but even for a lot of adults living with autism now, you have to be very, very mindful of the words you use, how fast you're talking, not using too many words, maybe just 1 or 2 word sentences, maybe also showing them the action, and then they may be able to follow suit in what you're saying. Another thing I noticed about some of the adults with autism and that some of those that I've spoken with is that they tend to ask a lot of questions. So if you say, carry the box and follow me, and then they ask you a question about that. So which box am I carrying? Why do I have to carry the box? Where am I carrying the box to? You already told them to follow you, but then they're asking you because they want to clarify. You know, a lot of adults with autism, they work, like I said, they go to college. So maybe in a college setting, you have a young woman or a young man that's asking questions, so many questions in the classroom. They will not even allow, the professor can get very irritated, and the other students, because they keep raising up their hands and asking. Sometimes they'll ask the same questions over and over again. You have to pay attention to people like that. It may seem that they are, you know, they have some autistic tendencies. They're trying to understand what you're saying. They're trying to process that information that you're giving them. And they process information in a very different way. So what I'm asking is that we be more patient and tolerant with people. One thing you have to know is that when you're talking to them, language is serving a purpose. So they will talk to you if you ask a question. If they want something, they will ask you, I want to eat, I want this, I want that. But they cannot, it's very hard for them to sit with you and have a conversation with you. You know, I don't want to say meaningful conversation, but a conversation, because they don't, like I said before, they don't have that repertoire of words. Anyway, I'm going to stop here today so that we can digest this information. I believe that with some of these things that I've told you, that when you encounter someone with autism, or maybe just somebody with special needs, just think again and say, maybe this person, you know, might be autistic. This person may have some special needs. This person may have a developmental challenge or a developmental delay. So it's important for us to notice these people, to be caring, to be empathic, to be compassionate towards them. Dr. Tade Talks we're on YouTube, we're on Facebook, we're on Instagram, and I recently just joined TikTok. So check me out on TikTok. Make sure you subscribe to our YouTube channel and share this video with all your friends. I'm sure it will be helpful to somebody. Until next time, take care and God bless.